Here's something that might surprise you. What if I told you that one of the most stable careers in South Africa right now is also one of the most ignored? Because while many people are struggling to find jobs, our healthcare system is struggling to find people, and the gap is getting bigger and bigger every year. In this video, I'm going to break down the healthcare jobs in demand in South Africa right now, where the biggest shortages actually are, and what it takes to get into these careers. If you've ever thought about working in healthcare, or you're just looking for a stable career path, this video might change how you see things. If you are watching this now and you haven't subscribed yet, take a second and hit that subscribe button, because every week I share practical South African focused career advice that can help you land the job you want faster. And here's the thing, when you subscribe, you're not just helping yourself, you are also helping someone else out there who needs this information but hasn't found it yet. So go ahead and hit that subscribe button now and let's grow together. Now, before we get into the different roles, you need to understand something important. When we say healthcare jobs are in demand, we are not talking about trends. We are talking about pressure, real pressure. Hospitals are full, clinics are overwhelmed, and there simply aren't enough healthcare workers to meet that demand. And that's what makes this sector different from many others. Because in healthcare, demand is not optional, it's constant, it's immediate. Let's start with what's really driving this demand. So, South Africa is facing a serious shortage of healthcare workers. If you walk into many public hospitals today, you will see long queues, overworked staff, and limited resources. And one of the biggest reasons for this is something most people don't talk about enough. A lot of skilled health professionals are moving overseas and they're leaving the country. They are moving overseas for better salary, better working conditions, and more opportunities. At the same time, the people who stay behind are dealing with burnout, long hours, and increasing pressure. And while all of this is happening, the number of patients keep growing, which brings us to the next point. Healthcare demand is not just growing, it's accelerating. South Africa's population is growing and people are living longer. But with that comes more chronic illnesses like diabetes, high blood pressure, and heart diseases. And these are conditions that require ongoing care. At the same time, mental health awareness is increasing, which means people are seeking help more than ever before. Private healthcare is also growing, which creates even more demand for skilled professionals. So, what you have is a system where demand is rising from every direction, but the supply of skilled people is not keeping up. And that's exactly why certain roles are in such high demand right now. Let's start with one of the most important roles in healthcare, nursing. Nurses are the backbone of the entire system. Without nurses, hospitals simply cannot function. Right now, there is a strong demand for professional nurses, especially those with experience in ICU, emergency care, and specialized areas. But even beyond hospitals, community healthcare nurses are also in high demand. These are the people who work directly in communities, clinics, and outreach programs. And here's something important. Nursing is not just about getting a qualification. It's about resilience, patience, and a real willingness to work with people in difficult situations. But if you are willing to go down this path, it's one of the most stable and respected careers you can build in South Africa. Hi, I know I'm interrupting your video, but this is important if you are job hunting in South Africa right now. If you've been sending CV after CV and hearing nothing back, the problem it's not you, it's your tools. That's why I built the Job Hunters Toolkit. Inside you'll get 5 proven South African CV templates, 5 matching cover letters, a job-winning CV and cover letter guide, the 20 most common interview questions with answers, and even 20 job boards where you can apply, including hidden ones that most people don't even know about. It's everything you need to finally land interviews all in one place. Click the link up here or in the description now to grab it and give yourself a real chance, because you deserve it. Now back to the video. Now, a lot of people think healthcare is only about doctors and nurses, but that's not true. There's a whole group of careers called allied health professionals, and these roles are growing fast. We are talking about physiotherapists, occupational therapists, radiographers, lab technicians, and pharmacists. These are the people who support diagnosis, recovery, and long-term care. For an example, after surgery, a patient might need a physiotherapist to regain movement, or a lab technician to run tests that help doctors make decisions. These roles are becoming more important because healthcare is becoming more specialized. And the more specialized it becomes, the more skilled professionals are needed to support it. Another area that is growing fast, and honestly, it's underserved, it's mental health. Most people are speaking honestly about stress, anxiety, and depression. And because of that, the demand for psychologists, counselors, psychiatric nurses, and social workers is increasing. But the reality is, there are still not enough professionals in this space, especially in schools, communities, and public health care. This is one of those areas where the need is only going to grow over time. Now, let's talk about what it actually takes to get into healthcare. This is not a space where you can just watch a few online courses and start applying. Most healthcare careers requires formal training. That could be a university degree, a diploma, or training through accredited institutions. You also need to register with professional councils depending on the role. But beyond the qualifications, there are certain personal qualities that matter a lot. You need empathy, you need discipline, and you need emotional strength, because you are dealing with real people, real problems, and sometimes very difficult situations. So if you are thinking about going into healthcare, where do you actually start? The first step is to choose a direction that fits both your strengths and your personality. Because not every role in healthcare is the same. Some are more technical, some are more patient-facing, and some are more support-focused. Once you've chosen a direction, take time to understand what the actual requirements are. Look at real study programs, real job descriptions, and what professionals in that space are doing on a day-to-day basis. From there, focus on getting the right qualification or training for that specific path. And if you're not ready for a full degree yet, you can also look at entry-level roles like community healthcare work or support roles to get exposure. The important thing is to start moving in the right direction early. The truth is, healthcare is not going anywhere. If anything, the demand is only going to increase. And while many industries are changing or becoming uncertain, healthcare remains one of the most stable career paths you can choose. But like any career, the earlier you start positioning yourself, the better your chances. So take your time, do your research, and choose a path that not only has demand, but also fits who you are. If this video helped you see things differently, please take a second and hit that like button and subscribe to the channel, because every week I break down real opportunities in South Africa and show you exactly how to position yourself to get hired for them. My name is Alec and this is 360 Careers, helping you grow, show up, and get hired. Let's go.